patients don't know that this intervention that they're doing in their oral hygiene may be the reason why they're still noticing those bleeding gums and that gum sensitivity. Our patients believe that it's okay to use a floss pick instead of regular floss. Now, here's why you don't want to technically do that. The problem with floss picks are most of them just have a thread attached to a handle, which is not flexible. So they usually enter between the teeth, because that is usually where you want to floss. That gum-like structure almost looks like a triangular piece that's between each tooth, and that's essentially where you want your floss to enter. Now with these floss picks, they don't tend to do that at an angle where it hugs that tooth as it's going below that gum line, because that is when flossing is effective essentially. Now these kind of floss picks only target that area at a 90-degree angle, whereas regular floss is a better alternative because you can play around with the angulation quite a bit, and you can really wrap that floss around that tooth edge. Now the reason why I say this is because most of that plaque is hugging that tooth, and when the floss picks essentially they go at a 90-degree, they are targeting some plaque. However, majority of that plaque is still staying behind. Now when plaque's still staying behind, it tends to get deeper into that gum, cause an inflamed pocket, which looks similar to gum inflammation. That swelling that you see around your gum, that's inflammation essentially, and then the bright red is indicating that there's pooled blood with that inflammation. Now, in order to relieve that stress from your gums, you need to make sure that your floss is entering at a 0-degree angle where it is really hugging that tooth edge and getting all of that plaque up. Inflammation is present below the gums. You tend to notice an enlarged area correspondent to redness. Now that redness is an indication that there's blood that's pulled in below the gum, and the reason why that occurs is when there is plaque sitting below the gum, it is stopping the blood supply. Like every organ, your gums also have their own blood supply, and the fluctuation of that blood below your gums is very important, because your blood supply that is below your gum is indirectly related to the blood supply that goes to your heart, and then your heart pumps it to your other organs. So it's very important that that blood supply is not disturbed. So removing plaque or not leaving any plaque below the gum is actually very important. And usually when you do come to your hygienist, and when she or he does your cleaning in that area, when that plaque is alleviated out of the gums like it should be, you will tend to start noticing that that reddish appearance of that gum tends to turn more pinkish. And that is an indication of health essentially, and that is also another indication that there is no blood, blood that is pulled below the gums, and the blood is sufficiently traveling like it should be. Usually when you get these cleanings done, or when a good amount of plaque or all that plaque comes out through scraping or other interventions that us as hygienists use, then it tends to alleviate that stress of that old blood, which can also turn into infection if not taken care of on time. And that's why it's so important to see a hygienist, see a professional that can deal with that plaque, or you yourself can use interventions such as regular floss over floss picks. A lot of times dexterity can be a concern, and a lot of patients are not just comfortable using regular floss, and they would prefer using floss picks. Now if you are somebody that is comfortable using floss picks, you want to make sure that you are helping that thread maneuver around in a state where it can enter your gum line and get all of that plaque off like it should. So a nice C-shaped configuration as you go below your gum line and you come out.